So I hope you can cope with a new technology. I have to say, it took me a little bit of time to get used to suddenly all sorts of new devices and new ways of doing things. And can I share with you a very historic moment? I'm actually in the middle of 4 parliamentary votes on the agriculture bill. And thanks to the new way of doing things, I can do this from home. I can do it while I'm chairing a meeting. And occasionally I just have to sort of switch over, look at my screen, my other screen, and cast my vote. Even that in Parliament wouldn't have been possible, because when we have physical votes in Parliament, the division bell goes and I have to leave the room. So this is a very special moment for me, a bit stressful, but a little bit that I can share with you as well, a historic moment for us due to COVID. And tonight we are going to talk, of course, about the COVID pandemic. And it is my great pleasure to introduce our senior clinical lecturer at Exeter University, as well as our councillor for Coombe Down, where he lives, Dr. Bharat Pankhania. Thank you for joining us this evening. It's a real pleasure. Bharat, you've been a consultant in communicable disease control for almost 20 years, most recently appearing all over our national and local media. Is this where you expected to be at this stage of your career? I mean, is it inevitable that when you work with highly infectious disease outbreaks, you think one day this is going to happen and I will have to go out there and tell people how to stay safe? So tell us a little bit about how you feel about this special moment, Bharat.
Want to listen to me. I really do, and I mean it sincerely, because people like myself are what we call backroom boys. I used to say to people that if you see me in a hospital dressed in a suit, it means there's trouble at this place. So I only get seen and recognized when there is trouble. So people used to see me in hospitals and say, now then, what's the trouble? So that's the job I have been doing for the last 20 years, always in the back room. I have planned for the unthinkable. We always sit and think the unthinkable and then plan for it. Things like bioterrorism, nuclear weapons, nuclear dirty bombs, floods, famine, pestilence, biochemical hazards, explosions, bioterrorism, anthrax, white powder, the list goes on. But I never expected to actually live through the worst case scenario in a pandemic like the one we are having now. I wake up in the middle of the night thinking, am I fully awake or am I dreaming? Because this is a very bad dream. I never expected to see this in the United Kingdom, a first world country. When this is over, I hope the historians are taking note. This is by any measure a very poor performance, and I'm very distressed about it.
So really what you're saying is you're planning for this for 20 years and then it happens and you can't believe it's happening. It's a strange thought, isn't it? But this is obviously the situation we are in. And in fact, I mean, we've heard as public, these things might happen, but we don't think it will happen. And then it does happen, and now we are in the middle of it and we need to deal with it. But when you came to the UK, you were just about 14. Did you already have your sights on becoming a doctor?
No, never. How can I? Vera, I'm a poor chap. I'm a son of a mechanic. I've never met nobody. I was the first ever Pankhania doctor. And listen, gentlemen, ladies, if I tell you this, you will think I'm not telling the truth. But this is God's truth. I was bright. I taught myself. And that's another story. I had to teach myself. My teachers didn't teach me O levels or A levels. We were in the non-exam class. But one thing I wanted to do was go and be a student for as long as possible. So medicine was 5 years. All the other courses were 3 years. And medicine did biology, maths, physics, chemistry, and all those things that I enjoy. So I said, I'm going to do that one, the one that gives you being a student for longer. And I didn't know, honest to God, I really didn't know that if you do medicine, you become a doctor. Honest to God, I didn't know that. Why would I know this? Nobody in my family has ever been to university, and I've never had any guidance on, go and do this, go and do that. So that's my story.
But tell us a little bit more, what was growing up in the UK like when you came?
So I would say, and I wish my children would listen to me, age 14, I arrived here, a little boy, very frightened, beaten up by the National Front every day. So we learned how to run fast from our schools. And it was a terrorizing time. This is 1974. And the hardest years were those 2 years, 14 to 16, doing my O-levels, because the schools in Kenya, which incidentally were much better than my school in Leicester, had told me that if you don't study, you've had it. So I knew that I wasn't in an exam class at school. So 9 to 3, I went to school to play, because we were in a non-exam class. We just played, we didn't study. And then after 3 o'clock, I'd run home, and at 4 o'clock, I would sit down to study. And I don't know what I don't know, because I don't know the syllabus. I don't know what to study. And so they were very stressful, but I taught myself. I taught myself from age 14 to 16 when I did a ton of O-levels. And having done the ton of O-levels, I'm here today as a result. It got me out of poverty.
Thank you. Thank you. That's, well, always still very distressing to hear that only such a very short time ago, really, growing up in this country was so unsafe. And things haven't necessarily changed, but hopefully things are improving, and we need to do a lot more. And it's wonderful to see people like you achieve. But as you say, it always depends still in the end on the people taking really their own initiative, although they're wonderful teachers about. But unfortunately, we don't achieve it with enough people. Anyway, here you are. You studied to be a GP in Cardiff, and then took further training in respiratory diseases and then in infectious diseases. Is this when you realize that primary prevention of diseases makes a much larger contribution to people's health?
So exactly. So there I was in my beautiful surgery in the Brecon Beacons, and I was a fully qualified GP, and I was seeing a lot of miners' lungs. This is from exposure to coal dust. And I felt bad because I didn't know how to treat these lungs. And the other thing I also saw was a lot of mental illness, depression, anxiety, and again, I didn't know, because as a GP, I hadn't been fully trained. So one thing I've always been good at is, if I don't know, go and learn about it rather than muck up on it. And so I went and took time off. I gave up general practice. I went and did a bit of psychiatry because I wanted to become a better doctor. And then I also went and did respiratory medicine because I wanted to treat these people with their miners' lungs. Having done respiratory medicine, I learned that by the time a patient is generated, it's too late. It's too late. There's nothing I can do. Even as a respiratory physician, I couldn't mend their lungs. So I thought, I know what I want to do. I want to prevent them ever getting miners' lungs. And hence, I started my third career in public health medicine, because I wanted to be the man who prevented illnesses from happening in the first instance. And that's where I have retrained in my third career.
Can I just tell my audience, in this weird world, the vote I just had to cast was to abstain. So that's why I didn't actually have to reach over and cast my vote. I've been abstaining in the third vote. There's one more to come. Sorry for the interruption, but I thought this is just so much today, how we are working on several platforms at the very same time in one room. Bharat, you've been a consultant in communicable disease for local authorities, for the Health Protection Agency and for Public Health England. What are the key messages when attempting to control the outbreak of a communicable disease? What are the key messages?
Follow the science, and the science is very straightforward. It's not complicated. It's not ultra complex. So with respect to the coronavirus infection and pandemic that we're witnessing, I do despair because it's made to look out as if it's very complicated. It isn't. The straightforward mantra of, identify that infectious case, pull him out, identify the contacts of that infectious case, pull them out, identify other contacts, pull them out, and find a vaccine, find a cure. And one more thing, primary prevention is a global effort, which we are not doing and we will pay the price for, which is you suppress it in your country, but you suppress it in other countries and you suppress it globally, and you do it simultaneously. Mark my words, we are not doing it simultaneously. We are driven by economic forces, and unfortunately, it will keep on coming around, and persist as a result of the actions we are taking.
You have been an expert in the tracking and spread of some serious disease outbreaks. Which diseases have you worked with?
So I worked with the full range so the ones that I really enjoy, because TB is a good one. TB tells you a lot about a country and its economics and the way it looks after its population. So I always tell my students, if you want to know a lot about a country, learn about TB in that country. You will know how TB is going and also how the country is going. The other good ones I've done a lot of work on is influenza planning, preparedness, pandemics, that sort of thing. And then, of course, we have the outbreaks, the noroviruses, the salmonellas, the campylobacters, the E. coli's, all very serious, as well as the more exotic and tropical ones, things like Ebola. So I was involved in Ebola screening at Heathrow and other airports. And then, of course, even SARS, we were heavily involved. Although we had 0 cases of SARS in the United Kingdom, we were extremely busy and heavily involved with containing and controlling SARS. And in fact, lessons from SARS have not been implemented in the coronavirus COVID-19 management, because we succeeded in eliminating SARS. It arrived and then we controlled it and it's gone because of public health measures that we took.
Well, you've been just describing some really horrifying diseases we've seen in recent years, SARS, Ebola. How much is this to do with environmental destruction?
A lot. This is of much pain to me, and it's man's incursions into the ecology of the planet and doing things that people should not be doing. I learned something very new recently, a phrase which was, wild animals are doing their best to run away from you. We need to do our best to also run away from them. And by messing around into ecological niches and doing things that we shouldn't be doing, like capturing thousands of bats and keeping them in captivity with other animals that are also kept in captivity next to the bats, we enable the reassortment of nasty viruses, which then emerge to infect mankind. So this is an ecological disaster that we're not even talking about. Similarly, I have been involved considerably with the evolution of pandemic influenza strains, which arise exactly like that. We have millions of chickens kept in captivity next to thousands and hundreds and thousands of, for example, pigs. And then pigs and chickens can get co-infections, simultaneous infections from each other's viruses. And then you can allow the emergence of a new virus. And if it is infectious to mankind, you've had it. So man's incursions into the ecology is very serious. And I have said this for a long time, spend millions controlling it and changing practice and telling people not to do things. For example, feeding antibiotics to animals to make them put on weight faster so that we can eat it faster and make more protein, more profit. If you carry on like this, we will have no antibiotics that work. And similarly, we will have new viruses also emerging. So you could spend millions controlling it, or you will end up spending trillions upon trillions upon trillions afterwards. So it's better to spend millions rather than trillions.
You've just been giving us a very good example. Don't feed animals antibiotics. Anything else that we could do in our practices that would actually stop cross-infection from happening? So
we need to live more sustainably, and this is the root cause of a lot of problems. We are living beyond the planet's sustainability. We eat too much meat. We eat too much animal produce. And if we can reduce our consumption of meat, then all those farming practices, all those incursions into virgin forests to make grass to feed the cows or to grow soya beans to feed the cows, etc., will decrease. So if I had just one simple message: live sustainably, reduce your meat consumption. And by meat, I mean any animal protein consumption. I mean fish, farmed shellfish and all those things, as well as farmed animals. We just need to reduce our meat consumption. It's very important.
I mean, we also know, obviously, that for the climate emergency, it is very important that we reduce our meat consumption. But again, globally, that's a very difficult message. It's okay for us here in the rich developed countries to say, look, guys, you can't have those diets that we have enjoyed for such a long time. Politically, that is a very difficult message, isn't it?
No, Vera, I think it is a good message, because look, take the state of Gujarat in India, where I come from, and the population of the state of Gujarat is 70 million. Of those 70 million people, about 50 million will be vegetarians. So it's a cultural thing. We've always been vegetarians. Even the country of Japan, a couple of hundred years ago, was a vegetarian country. Eating excessive amount of meat is a new phenomenon. It is not something we have always done. And now we're eating so much. As you get richer, you eat more of it. And unfortunately, planet Earth cannot sustain it. And we are causing a problem. Just think about it. No antibiotics to treat your sore throat. Just think about it. It means you may die. So it's as serious as that. COVID-19 is a trial run of things to happen and things to come. And we need to act, and we need to act fast. We're already running out of antibiotics. And when we run out of antibiotics, what will we do? So I think this is an urgent message, and we can take it forward. Less meat is not about we've had ours, you shouldn't have it. It's about actually better health, better sustainability.
Well, it's always good to think, certainly when it comes to the climate emergency, which has become a little bit of my hobby horse, or well, I'm not an expert, but I've really put my mind to it, that the interesting thing about big issues like the climate emergency or global pandemic, certainly the climate emergency, is we actually know what to do. It's just, why don't we do it? And then obviously come all sorts of political and commercial interests and forces in our way. But the interesting thing certainly about the climate emergency is we have the answers. We could actually do things, except we are not doing them, and that is really disappointing. Going back to COVID, we did know that something like COVID would be coming, didn't we?
Well, we never knew that something like COVID would be coming, but we always had a unknown respiratory pathogen which may appear, and what should we do about it. So we have always been planning for a unknown, highly virulent respiratory pathogen that arrives out of nowhere, and then what should we do? So whilst we couldn't name it COVID-19 or anything like that, we have been prepared. So when I hear politicians, no less, tell me that we planned for influenza, but we never planned for COVID, I say, I don't buy it. I don't buy it at all, because we have always planned for a respiratory agent of some description to arrive and do exactly what it is doing.
Well, and the big question is, of course, why does it now look more that the government wasn't very well prepared? Not just Britain, but it looks Britain was certainly not in the front line of being very well prepared. And you know, what did we do in this country? What did we do probably globally? Although we knew that something like this might be coming, that it looks like we were still so very badly prepared. Let me ask you one question. Britain was the last EU country to lock down. Do you think that the herd immunity was a distraction or a sensible option?
So let me go back to the preparedness, and then I will answer your question about lockdown. We are supposed to be prepared. I'm not going to allow politicians to get away with by saying we couldn't see it coming, therefore we didn't prepare, and other countries were not prepared as well, therefore we're absolved of this misdemeanor. I have been in this business long enough to know that we were preparing, we were exercising, we were horizon scanning, we were doing all the right things. We just refused to fund it. So in 2016, there was a simulated exercise called Exercise Cygnus, CYGNUS. And that exercise identified weaknesses in our preparedness. And those weaknesses are highlighted as a result of the NHS being underfunded, the private sector nursing homes being precarious and not well funded. So what we did was put our head in the sand. And I hope all you people who are at this meeting, because you're better than I am with these things, will take people to task about it, because the 2016 outcome of Exercise Cygnus was head in the sand. That's what we did. And that is why the United Kingdom faces 50,000 deaths today. It's very depressing. This is a first world country. It should not be allowed to happen. If Germany can do it, we can do it. Why has Germany, with a larger population than the United Kingdom, managed with so few deaths compared to the United Kingdom? We have made a mistake and we need to answer for it and hold people accountable. That's not my job. So with respect to the herd immunity business that you were saying, I find it hard to believe that our government would take such an action. So I'm in disbelief that maybe they thought about herd immunity. Because if they did, this is terrible. You should never do that. I think they have been under-advised. The shortest thing I can say. Somewhere along the line, the advice to them of shut down, act fast, act hard has not percolated through. I myself spoke end of February, early March to Nick Robinson, BBC Radio 4, and I said to him, we need to act hard and fast. And the reason why I remember this is Nick Robinson narrated it back to me and he tweeted about it. He said, Dr. Pankhania says we need to act hard and fast. What does that mean? And I said to him, if you shut down now, it's easier to shut that lid. If you shut down later when the lid is way open, it's very, very, very difficult to regain control. So, and I'm not the only person, I'm not a maverick. There are many academic, learned colleagues of mine who have been saying the same thing. You know, just think about it. You've got a little leak. You act fast, you can stop the leak. But if you've got a huge crack, then to regain control from a dam that's leaking millions of gallons of water is difficult. So early action saves lives. For whatever reason, we didn't take early action. And I'm very disappointed because people have died as a result.
Thank you so much. This was, you know, so much information in a very short period of time. We've got many, many people in the audience and they want to ask you questions. So I'm now going to hand over to Matt,
Okay.
who is sort of asking the questions of the audience through Matt. Thank you so much, Bharat. Fascinating stuff.
Thank you. Yes, and apologies, I'm slightly out of breath because I had to dash off and get my laptop's power cable as I was starting to run out of battery. So I'm going to start with a question from Anna. I'm 77 with lymphoma and have been enjoying lockdown so far, but would love some guidance on how long this will continue for me.
Anna, I hear you. I hear you loud and clear. Your lymphoma is very important, Anna. Therefore, your lymphoma makes you immune suppressed. You need to be very careful. If you get infection, the infection will have, it will make progress faster in you. So you need to be careful. You need to avoid getting infected. You need to carry on staying away from humans, as I say on BBC Points West all the time. Stay away from humans and stay away from places where humans congregate because we don't want you to get infected, Anna. And the good news, Anna, let me tell you this. When I was a junior doctor, people with lymphoma died. And the marvels of medicine have made it possible for us to cure people from lymphoma. So I want you to be cured of your lymphoma and live long to hold these people to account for mismanaging COVID-19. Stay safe, Anna.
Thank you, Bharat. We had a question from Nick about herd immunity, which I think we've covered. There's a question from Catherine saying, is Baines doing any contact tracing of COVID-19 patients? I don't think...
I can answer that for you.
Yeah.
So, Catherine, that's a lovely question. And I have been arguing the case for quite a long time now, at least the last 4 weeks, asking the government to allow us to do it locally. So I've had a lot of requests from Devon because I work in Exeter Medical School. So Devon County councillors have been very hot, independent ones, asking me, why can't we do this locally? We should do this locally. This is really important because I know the nuances. I know the people. The GPs know the people. The EHOs know the people. The public health people know the people. We know, as soon as you tell me I've been to the Carpenter's Arms, I already know your circle of friends and your circle that I need to contact and do contact trace and sequestrate. We do this every day, all the time. Unfortunately, UK government is not allowing us to do it locally. You guys need to put pressure on UK government to make this happen. The sooner, the better. We have employed private firms to do testing and contact tracing. Hear me out. It won't be as good as what we can do locally. We can do a much better, more precise, more useful job if we did it locally. We must do it locally. Please write letters to your MP over there and harass her because we need to do it.
Okay, thank you. And I've got another question here from Tim. 2nd of March, I had an incident. Community testing was halted. Do we know why? What were the reasons? Do we know the answer why it was stopped?
Yeah, so Tim, again, this is a problem of much grief to me because we sold it. This is why I feel painful. We sold it as The science says no more testing required because we've moved from containment to delay. And that was a big day for me, 12th of March. I felt a fork because until the 12th of March, if you look at my timelines on the media, I have been saying the UK government is a master of these things. It is a world leader in these things, and it does it well. On the 12th of March, we took a decision which I cannot understand. And I know why we took that decision, because we didn't want to do it. This is the shortest possible answer I can give to you. And now, finally, in May, what we did not do on the 12th of March onwards, we wish to redo. Again, I'm asking you guys to hold people to account and say, what was not right to do on the 12th of March suddenly becomes right to do in May. Explain.
Okay. So I've got a question from Mike, or two questions. I have a strong asthma inhalers and received a letter telling me I'm in shield with lockdown and mustn't go out even for exercise. Has that been eased under the relaxed rules this week, or am I stuck indoors? Number two, my asthma is much improved with the improved air quality on the London road. How can we keep the air quality legal after lockdown ends? Thanks very much.
Yeah, so Mike, you're talking to me, which is my bread and butter. Remember earlier I said I did respiratory medicine, and we used to keep people alive that London didn't know how to, because we became so good with our miners' lungs. I understand asthma very well. I would like to say the coronavirus infection and your asthma, I want you to treat it as independent events. Just because you've got asthma doesn't mean coronavirus will make it worse, not necessarily. Having said that, you don't want to get an infection. That's the bottom line. So you will do all you can not to get infected. Second point, pollution is a life-limiting event, and we need to be bold and take bold actions, bold, brave actions, because people die early who live in polluted environments. And we should say, we're not going to allow this to happen. Be bold, and we need to do something about it. I don't know what we can do, but we need to do something about it. You know, London Road and other parts of Bath are very polluted. We should stop it. We need to be bold and brave, but I don't know how to do it. I'm not clever in that domain of how to do it. I can tell you we should do it.
Thank you. Next question from Fiona. If CV19 is mutating, will a single vaccine be useful, or will we have to then look for multiple vaccines like the annual flu jab?
Yeah, Fiona, that's a good question, and happy to answer it for you. So the COVID-19 has a protein that latches onto a human receptor called ACE2, and that bit is not mutating, and it's pretty well stable and conserved, meaning from generation to generation. The other bits of the coronavirus may be changing a little bit, but the lock and key, the infecting agent at the interface of human cell and the coronavirus ACE receptor end, that's not changing. So I don't think we will have to make a new vaccine. And even if that receptor protein changed dramatically, it's no big deal. We can make a new vaccine if we find that it has changed. The trouble is, hear me out. Will we make a vaccine? Big question mark. I don't know, because coronavirus is an awkward beast. It doesn't induce strong immunity. And because it doesn't induce strong immunity, it will be a medical breakthrough if we manage to make a vaccine. So we mustn't put all our eggs into the vaccine basket. It may never happen. Just like we never made a vaccine for HIV, but we found medicines to manage HIV.
Interesting. Question from Tim. Do you think it's better for schools to go back in the summer months when the severity of the virus may be less than in winter? Or is there a danger we'll just have a second spike of outbreaks and then everyone will have to come home again?
So, Tim, everything we are doing at the moment is in one direction. You will get a spike in number of cases, and I'm very concerned about it. I'm really concerned, and I feel powerless to change direction. We do not know if children bring home infection to their parents and grandparents. In view of the fact that we don't know, opening schools is a hazard. It is a risk, because that question of, are children infectious, has not been answered. So I'm very concerned when Prime Minister Johnson said, schools will open. There is no explanation about where is the science which tells us that children are not infectious. They may be without symptoms, they may be without severe illness, they may be with all those things, but are they not infectious? I don't know. They are infectious as far as I know. So I need to be assured that they are not going to infect other people. That's the answer I'm looking for.
We've had a very similar question from Marco Sullivan on that, in terms of people getting infected and then become spreaders, and what's the equivalent of children, and can we quantify the risk of infection in different circumstances? So I think maybe you just answered that one. You mentioned as James says, you mentioned mental health. Wise makes the point of saying, why is selling alcohol an essential service but not Alcoholics Anonymous? That's a good point. Question from M. Cooper. It seems that the UK failed to learn from early experiences of Italy with respect to COVID-19. What lessons do you think we need to learn most from other countries?
So the evidence is there and it's clear to see. Go home and look at what South Korea did. They did a marvelous job. Similarly, if you don't wish to go as far as South Korea, go to Germany and see what they did. And Germany and South Korea did a marvelous job of containing it, controlling it, being on top of it, and managing it well. And look, countries across the globe have started to lift their shutdown, and they've all got spikes in number of cases. And they started from a lower baseline. We in the UK have got 3,000 odd new cases, minimum 3,000. So we are not in a position to lift the shutdown. I'm concerned that we are.
Can I just come in there, because for me too, that this is the most irresponsible way of looking at coming out of lockdown, because other countries are doing it, but our infection numbers and our death rate, in my estimation, is still far too high in order to even look at lockdown. That we've changed the stay-at-home message now to something different, I thought was very, very, well, disappointing, to say the least.
Yes, I'm concerned.
We've got a question from Helen on a similar thing. The government said today that estate agents can reopen. Is that a sensible solution? I mean, you get removal firms handling all your possessions as you move into the new house.
So Helen, this morning I was on BBC Radio Berkshire when I was asked this question, and I said all these activities are at-risk activities. The bottom line here is the government wishes to restart the economy. And listen, I'm not a politician, I'm a scientist. I might be a counselor, but I know nothing about politics. I feel we need to separate out life, living, humanity, all those things that make us human beings from economics. And we are mixing the two up and selling it as kosher. It's not right. We are making mistakes here. To me, all lives are sacred, and our economic activities can be readjusted. But if you are dead in your coffin, there's nothing you can do, you're dead. And similarly, if you lose your brother, your sister, your mother, your grandparents, etc., you will eventually have a large number of people who are very, very angry. And we don't want angry people in the society because bad things happen then. So it is in our government's interest to think about humanity first, and then be bold and brave and say, economically, we will have to make adjustments. And I don't know how you do those adjustments, but I think human lives come first.
Okay, Denise and Chris Rogers make the point about herd immunity, which we talked about earlier. So I've got a question here from Helen, whose 18-year-old son is trying to decide whether to go to university for the start of this coming academic year. But with the dangers of everything being online and not being able to make friends, the risk of mental health issues, what would your advice be? Defer for a year?
Yeah, this is a difficult one. As an 18-year-old, I know what, if I could turn the clock back, what would I do? I would definitely take a gap year, but a gap year equals travel, but that has also got its risks. I teach at my medical school, and I find that the mature students have got a better grasp of things. In the UK, we push things at too early an age. Therefore, if I were to advise Helen and Helen's son as my own son, I would say it's good to take a break, go and do something different. And in that 1 year, you do a bit of growing up and see which way the lie of the land is. By all means, enroll into university, but take a break. I think taking a break is a good idea.
Okay, I'll pass that one on to my son as well. We've got some comments supportive of what's been said. One for the road says, I'm a chimney sweep. As an industry, we're returning to work in people's homes now. Is this a bad idea? Why, if Ireland can test all care home residents and staff, why can't the UK?
So we have failed with respect to our testing. We have failed, and it is better to say, I'm so sorry, we've made a mistake, we could have done better. We are not a third world country. So yes, we should have done better. With regards to sweeping chimneys and things, you're entering people's homes. Then my advice to you is the more homes you enter, the greater the chance that one day you will get infected. So what you do is before you enter somebody's home, you pull yourself back and think about it. What am I going to do? What is my route into that house? Who am I going to interact with? How am I going to get in and get out of that home? Map that out in your mind and have minimal contact with the occupants of that house. Do your job, get out, and go home or go back to your car. Make sure you wash your hands thoroughly. Make sure you were wearing a mask and things in that place. Take all that things off carefully, slowly, meticulously. Wash your hands before going on to the next job. That's what I would be doing. And that is what I have been advising people who go into people's homes. I've been asking them to step back, take a deep breath, do it slowly, do it carefully.
I've got a question here from Nick, who is asking about the makeup of the SAGE committee. Do you think we've got the right people on the SAGE committee?
So if people have been following me on Twitter, they will know that myself and many of my colleagues have been complaining about, tell us who is on SAGE. And eventually we found out by a leak who the membership of SAGE were. And when we found that out, we felt, yeah, vindicated in moaning about it, because we found that it had, for example, 6 mathematical modelers, a few behavioral scientists, a few academics, and zero infectious disease control from the coalface. People like myself who know a lot about what does an outbreak look like in reality and have done it. We had no directors of public health. We had no clinicians from intensive care units. So my answer is, I feel SAGE has been unbalanced by having too many modelers, behavioral scientists, and academics from universities who haven't done the coalface work. And furthermore, and this is really important for the government to take note, is when you listen to one set of modelers, for example, from Imperial University, you should also look at another set of modelers, for example, from Oxford University, consider both their opinions and then make a balanced judgment. That is called taking a balanced view, rather than take the view of one set of modelers, ignoring the views of another set of modelers. So we need to be balanced. We need to be a diverse range of experts in the top table advising the government, because this is the lives and well-being of our country.
I've got a couple of questions from Kevin, but from Kevin on going back to the schools, and I think if schools have to go back, what's the safest way to let children go back to school? Say on the 1st of June. Or would you say there isn't?
I feel there isn't. I cannot buy that you will have social distancing and all that is being promoted. If the background level of viral activity is as high as it is today, it's not safe.
Unequivocal. That's a good answer. I've got a question from FMW. There's obviously been lots of sort of not quite published scientific papers knocking about what might help. So the question is, why is the government not pushing hydroxychloroquine as a
hydroxychloroquine?
Yeah, that one, and immune system boosting measures such as vitamin C, vitamin D, zinc supplements, especially vitamin D for the BAME community, whose vitamin D may be a factor in their increased mortality.
Yeah, happy to answer all of that. Lovely question. It's my bread and butter. That's what I do every day. So look, very important. We must be scientific. We have to be scientific. We mustn't dabble. Hydroxychloroquine is cardiotoxic. People have died from taking hydroxychloroquine. If it works, of course we will use it. There are trials going on, and at the moment, early reports from hydroxychloroquine are no evidence of effect. So we will watch and wait and see about hydroxychloroquine. Remdesivir, again, another antiviral drug, acts on viruses, proteins, and enzymes. There, the ground has been muddied by Gilead, the manufacturer of remdesivir. So you see, there are conflicting interests here. Gilead, of course, that's the manufacturer, wants to push its drug, and it managed to push it, considering the proper science on it has not been done. So I am a bit concerned about the FDA in the USA saying we may use remdesivir, because they fudged it by saying it reduces the length of illness. Crazy world. Reducing the length of illness does not correlate with, does it save lives? And I'm in the business of, does it save lives? So you know, do you see how people fudge it to get their product sold? We need to have robust scientists with good backbones at a difficult time like this to say yes or no, rather than be pushed into, yes, we'll license this and so on. Please be assured, FMW, all remedies are being judged scientifically, and if proven useful, they will be implemented, but we must remain scientific about it.
Okay, got a question from Jean-Yves. A bit of a setup. Due to the pandemic, messages from government are emerging advising the public to avoid mass public transport modes and use cars, walking and cycling to reduce the risk of propagation. So a question to you is, could this example of government message be an opportunity to promote a transformational change for the curative healthcare model that we're currently following, and promote a more preventative healthcare model, such as more cycling, walking, less meat, which would then help with the climate emergency? So we sort of touched on that. And then Vera, there's a follow-up question, is what's the Lib Dem plan to promote transformational change?
So the elephant in the room, as you see my lovely elephant behind me, the elephant in the room that government cannot talk about is, it says don't go on public transport, but it doesn't say if you have to go on public transport, wear a mask. It's blindingly obvious, right? Not everyone has got a car or can cycle in freezing cold British weather, etc. Right? So why don't you say it? It's the elephant in the room. You go on a public transport, buses, crowded trains, etc. Your chances of getting infected are higher. Accept it. Say it. Be truthful. And then say, and therefore, I have to advise, wear a face mask if you're going to go on those trains, buses, crowded platforms, etc. On the other hand, again, I'm not a politician, so I don't know how land grab and all these things work. But I think this is a lovely opportunity for us to introduce healthier measures like wider cycling lanes, wider walking areas, more walking, less cars, and less of all those unsustainable activities. But we're as a better agent for those things.
And indeed, we have written a couple of letters to the Transport Secretary and to the Housing or Community Local Government Secretary exactly around this, and particularly giving more powers to local authorities, because we are a very centralized country and local authorities are often very limited in what they can do. So give the freedom to local authorities to put in place these measures. But coming back to the previous question about shouldn't we become a much more preventative society, and that question actually has been bugging me for a long time. And I wouldn't say there's necessarily a Lib Dem policy around this, but clearly we find in so many cases that prevention is so much better than cure, also in terms of outcomes, as people call it. It's just cheaper in the end. The problem with the way we are operating politically is you have to measure everything. So you can only measure something that has happened. It's very difficult to measure stuff that is preventative. And in another meeting, I asked the other day, I think it was one of our sort of sustainability platforms, why couldn't we can mandate all sorts of things these days? We mandate this or that outcome, or we mandate a target. Why can't we actually mandate prevention? It would transform suddenly a lot of stuff that we do. But currently, we are always firefighting, or we only have something happens, and that you can measure. So yes, it would be a very big, different way of doing politics, society, and so on and so forth. And I'm the first one to promote it. And I'm exploring the idea of how we could actually mandate prevention, but currently we are not doing that.
Question from Mark, which I'll summarize as, how long does the virus stay viable on a surface? So, he stopped taking a paper, but he's, collecting his shopping. If somebody coughs into their hand, touches your shopping, passes it to you, how long does that virus stay viable for on that surface?
Yeah, Mark, this is a question that a lot of people ask, and it depends. So it depends on where the package or the contaminated surface is. Roughly speaking, on absorbent surfaces, it lasts, quarter of a day, half a day, that sort of thing. On hard surfaces, it may last for up to 2 days. Therefore, door handles, sanitary ware in bathrooms, toilets, I expect it to last a lot longer, and those are danger places. Whereas fabrics, cardboard is a little bit longer. Paper, which is quite absorbent, and therefore it dries the virus particles out, shorter. So absorbent surfaces, shorter period, I would say quarter to half a day. Hard surfaces, up to a couple of days.
Kevin's made the point that if you worked in the school, how confident would you feel about being safe? But I think we've answered that one, not at all. FMW, just coming back, about deaths. Obviously, deaths are being reported as people dying from COVID. The suggestion is that distorts the data from people who have terminal conditions, if they're dying just a few days or weeks earlier than, say, from a terminal heart condition or a cancer condition? Is it distorting the data, or is it just fact?
No, I hear what FMW has said. This is excess deaths, and we are not increasing the number of counts of COVID-19 deaths by writing it on somebody who was about to die. If anything, there is a lot of undercounting of COVID-19 deaths, because when you write this death is due to COVID-19, it entails a lot of paperwork, extra paperwork. And I know that if I didn't really care. I wanted to get on with my work. I didn't want the hustle. I was harassed, all that. I know what the easy thing out is. Died of age, and you don't get challenged. So there is quite a bit of under-reporting. We need to be thorough with recording this. And if you are asking, are we exaggerating the number of cases? No. In fact, we are not reporting as much as we should be. We are under-recording deaths by COVID.
Okay, I've got a question here from, might be Richard's family. I work providing support to vulnerable clients who are at risk of homelessness. I'm currently continuing to provide most of the support while working from home. When I'm required to visit clients face-to-face again in their homes, and bearing in mind that I'm over 70 with controlled asthma, can I realistically hope to adequately protect myself from COVID-19, and how?
So, Richard, my answer to you is the same one as I gave for our friend, the chimney sweep, which is you will have to do it slowly and carefully and think about what you're doing. But all said and done, in the age group that you are in, you are at greater risk of severe illness if you were to catch a COVID-19 infection. The risk in a 70-year-old is quite high. In an 80-year-old, it's very high. In a 70-year-old, it's pretty high too. Be careful. Try all you can not to get infected. This is important. You've made it to 70. I want you to make it to 90, 90 plus. Why shouldn't you? Please be very careful.
Good advice. Question from Jane. Should the entire UK be following the same advice, or can England have different advice?
No, Jane, I'm with you. And you can see how frustrated I feel that Wales, Northern Ireland, Scotland have taken the same line as something I started to hammer away a few days before Prime Minister Johnson was going to make his announcements, because I was concerned that he will make an announcement lifting the shutdown. So I was doing my bit of hammering away saying, please don't do it, please don't do it, please don't do it. He did it anyway. And my evidence is there for everyone to see. Wales, Northern Ireland, Scotland have taken a different line for a reason.
Question from Sue. She's in a choir. So her question's around when will these sort of large memberships, sorts of clubs, or indeed maybe go on to large sporting events where there's big audiences or live music or theatre. How long do you think before we'll see those be able to safely reopen?
So my answer is, for 2020, you would be well advised to cancel all events. Just cancel it. Until we have clear evidence that the circulating virus in the community, subject to extensively testing, indicates that the viral count in the community is low, 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 and low in the few hundreds, then I feel we will be in a safer environment. And then evidence that the environment is being maintained, meaning your borders have been secured and you haven't got new injection of infectious people coming into the UK and creating the flare up, which they did from the returning skiers from Italy. That's how it was introduced into the UK uncontrollably, the returning skiers from Italy. So I would need those reassurances as well as evidence that the number of infected cases in the UK was falling, and it was in the few hundreds. Then I would feel maybe.
Similarly, a question from Liz, with quarantine increasingly required for foreign travel, she's can you see a time when people with immunity will be microchipped? I mean, if you have to provide some sort of certificate to say you haven't got the disease, how long is that valid? Because you touch something else, you might pick it up.
Lovely question. I get the drift of it. Lovely question. Very important question. This is, again, unknown territory. Coronavirus is an awkward beast. It's not influenza. When you get an infection with influenza, you make immunity and you're immune from subsequent infection. With coronavirus, we don't know. So you may make antibodies, but does that mean those antibodies are now protective? And if they are protective, are they protective for 3 months, 6 months, 9 months, a year, a few years? We don't know. And this is in question to somebody is going to ask this question, so I'll answer it now. Making a vaccine is therefore difficult because coronavirus is, as I said, an awkward beast. It doesn't induce immune memory. And if it doesn't induce immune memory, then to make a vaccine against something that doesn't induce immune memory is a tall order. So there's a difficulty here. Are we going to be immune post-infection? I don't know. Will we make a vaccine which gives us immunity? I don't know. When I say I don't know, I mean we don't know.
And so that was then a question from me as well. Do we think there's a genetic link to who is getting infected and suffering really badly, who's getting infected and barely having any symptoms at all? Is there a genetic?
No, there isn't, but I'll give you some parameters, and this is also something for us to hang our heads in shame and feel sorry and do something about it, ask our politicians to do something about it, right? It affects males, older men, obese males, men with diabetes, blood pressure, heart disease, and it affects poor people disproportionately because poor people are more likely to work in environments which get them infected. So it is affecting disproportionately poor people because they can't sit at home and do Zoom meetings and earn their living. They have to go out, they get infected. Poor people also carry a burden of illness, diabetes, obesity, blood pressure, heart disease, and then men. So all of these categories are all at risk. And a lot of BAME people, Black, Asian, ethnic minority people, are also into this category of at risk. Some of them because of poverty, and the other bit is we don't know. We just don't know why these Indian, Asian doctors have all died. We wonder if they were exposed to a lot of loading dose and that's why they died. Or was it because they were carrying background diabetes, heart disease, and blood pressure as well? We don't know.
Got a question from Len. How accurate is testing for COVID?
Yeah, good question. Again, it looks you're all well-tuned people. So lovely question. And therefore, you must not have all your eggs in the testing basket because the test is 30% incorrect. In other words, it gives you a false negative 30% of the time in expert hands. So therefore, visualize this scene. We have got these test centers not run by people who know the art and craft of taking a sample. And we know that in expert hands, the result is wrong 30% of the times. Therefore, at test centers, I expect the test results to be wrong at least 30% of the time. And we need to go with signs and symptoms as well as test results when processing is somebody infectious or not. Finally, I would say consider everyone, every person, every time, all the time as infectious, no matter what the test result.
Question from Alison. Daughter-in-law is pregnant, and she and my son and their 1-year-old and my 1-year-old granddaughter are self-isolating, as are my husband and I. Can I not help with childcare?
But
So
if you're all self-isolating, why not? You're all in one unit, meaning you're not in contact with an outside human group who may...
I think there's 2 groups here. So it's like 2 bubbles.
Yes, but those 2 bubbles, if I'm understanding them right, they're 2 bubbles, but they are isolated bubbles. So this is a bit like New Zealand and Australia are 2 bubbles. And when they have 0 cases in their country, they're going to merge as one big bubble. So similarly, as long as you are 2 secure bubbles and not having extraneous entry into either of those bubbles, you could argue that those 2 bubbles could become one.
Gosh, I'm aware that there's 20 minutes left and the number of questions is growing. so there's 32 waiting questions.
I'll hurry up.
Well, Mike's come back again. If you fear that there may not be a vaccine against COVID-19, will the shielded lockdown ever end?
We will have to learn to live in a different way. This is a new way of living, and we have got all the warning signs that we need to change. Mankind has had a big kicking, and the new mankind and the way we live on planet Earth will have to change. We will have to change.
Do you think, James asked the question, if we ended up with a no-deal Brexit, could that cause problems with ensuring we get vaccines that are manufactured from abroad?
Well, I have said a lot on this subject before, which is at the moment we've got a hare running. In other words, there is a race to who gets the vaccine first, and then they can get all the royalties and everything else. I personally would have preferred a universal global model of everyone working on one vaccine in all their different countries, and they did it for mankind and humanity rather than the prestige of we discovered it first. So that has been my default, and I've often talked about it.
James come out with a question, how much does fitness help you to combat COVID if you catch it? My husband's extremely athletic, but he's 79.
Was good. Well done. Look,
You know him.
tell him, please continue to remain fit and well, because it is being fit and well that actually takes you through a lot of hurdles. So being fit and healthy and eating well is the best medicine ever. And please carry on with your fitness.
Question from Dave. I've been in lockdown for 7 weeks, and yet the virus infection period is 2 to 4 weeks. What is the main reason you think there is for the virus to be continuing to spread?
Yeah. Because we have weaknesses in our shutdown. This is the point. Our shutdown is not tight enough, and because it's not tight enough, we continue to generate cases. So if you have my question to Nick Robinson, a hard and fast action now. So when you have a hard and fast total shutdown, you have it for a shorter period. If you have a lackadaisical shutdown, you prolong the agony. That's the issue.
Question from Liz. With hospitals focused on taking COVID-19, treatment for patients with many other conditions is less accessible than usual. What's your view on this and how this is being handled? Yeah,
I think there has been an overreaction, and I feel that's a mistake here. So I expect attrition. I expect loss of lives as a result of mixed messaging. So the mixed messaging was, don't call us, the hospital is full of COVID-19. So we have not seen the people with the chest pain, the strokes, the abdominal injuries, the children with severe infections, and a lot of pathologies, and cancer treatment has been delayed or put back. So I am sad that that mixed messaging meant people didn't consult their doctors for serious issues, heart attacks, strokes, abdominal, children, etc., cancer. I expect attrition from there too.
Tim's pointing out there's now an independent SAGE group's been set up. Do you think that's a good idea? Has anything come from that yet?
So, where the awkward squad. So that's the awkward squad, and they're all my mates, and you all those things from my mates, the awkward squad. It's good. It's good viewing. It's good listening. At least take a balanced view. See what they're saying, compare it with what is happening, and then make your own judgments. I have consistently taken the line of hard and fast, early control, test, identify, contact trace, all those things. So that's, I think, what the awkward squad are saying.
I had a question about Sweden. It seems that Sweden have been able to do it differently. Is it a success?
Yes and no. So Sweden is not the United Kingdom. Sorry, can I just go back to the awkward squad first?
Oh, yeah.
Yeah. Take note, the awkward squad is chaired by no less than the former chief scientific officer of the UK. This is serious. Why is the chief scientific officer, former, chairing an alternative SAGE? It tells you something. Let me go back to Sweden now. So with respect to Sweden, it's not the UK. In other words, it's not so crowded. And culturally, Sweden does a lot of things outdoors. And when you're outdoors, you're less likely to be in an infectious environment. And it has also a younger population. So all those things worked in Sweden's favor. Having said that, Sweden has got a large number of deaths in their vulnerable group, nursing homes, care homes, ill, vulnerable patients. So they haven't got away with it scot-free because they also have a vulnerable population which has taken a hit. And it has got away with its younger population because it's a more outdoorsy country, lots of open spaces and less crowding.
Question from Nick. France identified a case in December. Is it likely that it was in the country before then? I mean, without testing, how would we ever know how prevalent the disease, the COVID-19 is?
Yes, I have taken note that actually the virus had arrived in France much sooner than we thought. We will get to the bottom of this. So when we have people with respiratory illness, unexplained respiratory illness especially, we often take samples and store them in deep freeze. We just keep them for 10, 15, 20 years. So what we're going to do is take those samples out and have a look for the presence of COVID-19 in the samples in the deep freeze. And that will tell us if the virus was here in December or even November, who knows, but we will find out in time.
There's a question about the events that took place in that last weekend before lockdown. Did the government leave it too late to stop the big events like Cheltenham and the Bath Half?
Yes, is the unfortunate shortest possible answer I can give. And please don't tell me in hindsight it's okay to be smart. People like myself were saying, and I am on record as even mentioning the Bath Marathon to our council leader, that it should be cancelled. So yes, the shortest possible unfortunate answer is we should have acted a lot sooner. And please, this is not hindsight. We were saying so. It's just that it didn't happen.
Yeah. What about, did Cheltenham had a cluster? I mean, the West Country's been very good in terms of ensuring that it hasn't been too severe an outbreak. But was there a cluster around Cheltenham after that event?
Yes. So yes, there was a cluster in the Cheltenham area. the reason why I feel the Southwest has got away with it is seasonality. So as it arrived in January-ish in the UK, December even, that's not the holiday time. So people were not bringing it to our region. And by the time summer came, and we've already got a shutdown. So we have had a fate of luck in that it wasn't introduced in a widespread manner in the Southwest, because people don't come to the Southwest in January. It's too cold. And one more thing, in Treliske, in deepest recesses of Cornwall, we have a spike in the number of cases, and we are pretty sure that that spike, Treliske Truro area, that we feel that that spike is as a result of second home owners introducing infection, coming to their second homes.
I had a question from Nick, possibly to Vera, but because the Lib Dems cancelled their spring conference because of COVID-19, but has the party missed a trick by delaying the leadership election until next year? Labour are up and running with Sir Keir Starmer. We're just in a bit of a vacuum with an interim leader. Obviously, there would be politically difficult to be running a leadership campaign whilst people are actually dying from this serious disease. But for a party like ours, I mean, when is a safe time to run a leadership campaign?
So,
Not a question for me.
The problem was that we were behind with with running our leadership election anyway. We would have been in the middle of it now, whereas the Labour Party had obviously immediately after the election announced that they would be starting a leadership contest, whereas we were going to leave it until the early summer anyway. And then COVID caught up with us, and I do believe it was the right decision to postpone it. Whether it will be postponed for all the way to next summer is very questionable. The party and the federal board are going to look at the decision again, and, for example, look at ways now to have the whole contest online, as we experience all these things are possible. And I just say watch this space.
So Bharat, there were a number of questions around if you have to go back to work, what is the safest way to go back to work in an environment where there's lots of other people?
So I feel sorry. That's my first thing I want to say. I'm sorry. I really am sorry. I wish I could make it better. These people who have to go back to work are at risk of getting infection. They're at risk of bringing that infection home. They may infect other people in their home who are more vulnerable. And I'm very sorry. Having said that, how can I make it better for you? I say, take all necessary precautions not to get infected. You're going to have to work in a different way. You have to be less sociable. You will have to not meet up with mates at work. Sitting 2 meters away, I'm not convinced will protect you. So as a minimum, at least wear a mask at work, and take change of clothes. So what you wear at work, you leave at work, and then you come home with a new pair of clothes, or when you come home, change in your garden and then enter your home, and do all those precautionary things. And if you guys want this advice written for you to follow, I will write it for you, because I think there is a need for you to have this advice. So I will write it for you. And you need to have this step-by-step way of what to do, how to do it, and how to protect yourselves. So look, I will write something for you. How's that?
It sounds like an excellent idea for us. And I think we're really very much coming now to the end of the evening. And Bharat, you have really been asking so many questions in such a wonderfully, colorful way, and so accessible as well. I'm sure everybody has taken something away. I'm so sorry that not all questions could be answered. But we've said we do this for an hour and a half, and we are really so grateful to you. So I said at the beginning, this is not this is our first event of many. So we are looking forward to our next event with Bath University Vice Chancellor Professor Sue Rigby. Look out for when that event is. It's been a pleasure to have you all here in this virtual room. Thank you again, Bharat, and I hope to see you all very soon again.
Thank you.